As part of the National Cancer Vanguard, the Christie was chosen to run a pilot study using a healthcare symptom tracking app. So it's actually a company called uMotif who created the app, and they use it in various centres in the UK and around the world. So we approached them and said would they like to join in, and that's kind of how we ended up with the app. And it was really just looking at patient acceptability, so it's quite a small scale study. We actually had really good uptake of that, so it was really successful. We had 44 patients download and use the app, and what we actually saw was a much higher than average usage of it. So the expected amount that patients would use it, we actually had a lot of patients using it more than that, so that was really positive. It was a really small pilot study just to check patient acceptability, so we weren't really collecting any of the data. But what the plan is now that we know patients do like using it and that it could be really useful for us, we are planning to do a larger scale trial with it, so we can define how often clinicians should be looking at the portal and how exactly we want it to work if we did roll out on a larger scale. So we're really looking forward to doing that. We didn't really get any negative feedback about the app itself, and the only negative feedback really was from patients who didn't want to take part, and that was usually because they didn't have a smart device that was compatible. But they thought it was very easy to use, they thought it was really helpful, they liked the idea that someone could check up on them, and they really enjoyed using it.